Good day everyone, I'm Dr. Koon, a consultant palliative medicine in Beacon Hospital. Here today to share with you about our palliative care service. Palliative care is a care given to enhance the quality of life of patients who have life-limiting conditions such as cancer. Palliative care is an approach that addresses the person as a whole and not just their disease. It addresses not just the physical but also the psychological, social and spiritual needs of that person. By improving the quality of life of patients, palliative care can bring hope and control back to patients and help them live as well and as fully as possible. The palliative care team are equipped with training and skills in pain control and management of other symptoms that are caused by the disease or its treatments. They provide holistic care to patients and family or caregivers focusing on the physical, emotional, social and spiritual issues. They embrace a patient's values and goals and wishes when considering their disease management. They help share the patient's plan and wishes with their family and friends. So what are the issues addressed in palliative care? The palliative care team focuses on the holistic needs of the patient and can help with a wide range of issues. For example, addressing their physical needs. The palliative care team could help address symptoms caused by the cancer or side effects of its treatment. Its common physical symptoms include pain, fatigue, loss of appetite, nausea, vomiting, shortness of breath, and insomnia. We also address the emotional needs of our patient. The palliative care team provide resources to help patients and family to deal with the emotion that come with a cancer diagnosis, and also cancer treatment. Depression, anxiety, and fear are a few of the concerns that can be addressed through palliative care. We also help address our patients' spiritual needs. An expert in palliative care team can help patients explore their beliefs and values so that they could find a sense of peace and reach a point of acceptance that is appropriate for their condition. We also address our family's caregiver needs. Family members are an important part of cancer care. It is common for caregivers to feel stress, particularly caring for a sick relative and dealing with all the extra responsibilities placed upon them such as work, household duties, and caring for other family members. Palliative care team can help families and friends cope in this challenging situation and give them the support they need. We also help address the practical needs of our patient. Palliative care team can assist with financial, legal issues, insurance questions, and employment concern. Discussing about the patient's goals of care is also a vital role of palliative care. This includes discussing about advance directive, enabling communication about patient care among family members, caregivers, and also members of the oncology team. Who would benefit from palliative care? Anyone who has an incurable lung-limiting condition would benefit from palliative care. For example, cancer, kidney failure, heart failure, chronic obstructive pulmonary disease, or other lung diseases. Brain diseases such as stroke, ALS, Parkinson's disease, or other neurological conditions such as multiple sclerosis, Alzheimer's, or other form of dementia. Patients could access palliative care regardless of their age, culture, background, or belief. So who provides palliative care? Often, palliative care specialists work as part of a multidisciplinary team that may include doctors, nurses who have received special training or qualification in palliative care, dietitian, pharmacists, chaplain, clinical psychologists, speech and language therapists, social worker, and volunteers. The palliative care team work in conjunction with the patient's primary care doctors to manage their care and maintain the best possible quality of life for them. Many now still believe that palliative care is only for people who are terminally ill, when there is no further treatment available for their condition. But in truth, palliative care can be given to any patient at any point of their disease trajectory. Receiving palliative care does not mean that patients are discontinuing any active treatment or giving up hope. Patients could receive palliative care alongside active treatment. In patients with cancer, at any point throughout their cancer journey, palliative care could address pain or any other symptom that could be caused by the cancer or the side effects of chemotherapy or radiotherapy. It also helps support patients and their family through their treatment and help them to have a better understanding of their condition and treatment. At Beacon Hospital, treatment may comprise of various number of healthcare professionals depending on the type of treatment. We adopt a multidisciplinary approach which includes clinical oncologists, medical oncologists, physician, neurologist, neurosurgeon, cancer and palliative care nurse, as well as other allied healthcare professionals. Led by a team of 9 resident oncologists, hematologists, surgeons, as well as allied health staff to provide you the best. We strive to improve the quality of life for our patients at every phase of their disease, from early detection, diagnosis, treatment to supportive care. Lastly, I would like to say Beacon cares for you. Your health is our priority.